Hi, I'm Dr. Roy Mittman. I'm one of the physicians at Seaview Orthopaedics. In fact, I'm the oldest one here at Seaview Orthopaedics. I'm the senior partner, been around 30 years plus, and I've been doing all types of orthopedic surgery, but over the last few years I really concentrated on joint replacement. I'm here with my patient, Stephen Keene, who has had bilateral knee replacements by myself, had a hip replacement by my partner, Dr. Arthur Mark, and then I dabbled a little bit into this trigger finger for him. So Stephen's been a long-time patient of mine. He is 83 years young. He's out golfing once a week and causing as much trouble as he can, shooting very well, and feeling pretty good. Going back to the time before your knee replacement, Steve, I think it was several years that you really had suffered with the knees. I wasn't sure how many.
Well, that's true. I never thought about doing that kind of surgery until I was having lunch with a friend 5, 6, 7 years ago, and he told me about having his hip replaced. And then it dawned on me that maybe I might be a candidate because when I played golf, my knees got very sore, and the tibia was stuck out to the side.
You had a deformity of your...
There was a deformity, yeah. And it was very sore, and our good friend Steve Gepp told me to come and talk to you because his mother-in-law was operated on by you for a knee, and she was very happy.
I did Steve's knee, in fact. I did Steve's knee replacement.
That's right, yes.
I think maybe that was before yours or after yours. I don't remember, but...
Oh, it was after me.
I still see Steve. But before you had the surgery done, were you able to play golf, or were you really...
That was one of the first questions you asked me. And I said I could play golf, but the x-ray showed there was bone on bone. And it was very sore.
Yeah.
And one of the things I liked right away was the fact that you were conservative. You said you didn't want to, if you took x-rays, and you showed me that there was bone on bone.
Right.
But you suggested we try a cortisone shot before you went into surgery.
Right.
And you said you didn't think it would work.
Sometimes it's very tough when it's bone on bone, but you always want to try some conservative things first.
That's what I liked.
Before jumping into an operation. And then, the decision was a difficult one in terms of having both knees that were equally impaired, whether to do one or to do both in one sitting. And although we don't do that frequently, you were in pretty good health. And when we looked over everything and got medical clearance, it seemed like, why not? Let's go for it.
Yeah.
And I probably in my time here, my years here, I probably do 5 to 10 bilaterals a year. But you were an ideal candidate. Obviously, you followed through on everything. You did the rehab. You worked hard.
That's very important. I have good friends that had the operation. They didn't do the rehab. If you're going to have any kind of joint replacement, you've got to make up your mind that even though it might hurt, you've got to do the rehab.
I kid with some of my patients, and I tell them, if you don't do the rehab, I'm taking the knee out.
Yeah, I know you kid, but there's a lot of truth to that.
I know, and you did the rehab, but a lot of people get complacent and think that you do the surgery and all of a sudden they're just going to walk out and be fine. But it takes a lot of devotion, it takes a lot of work.
Yeah, well, when you're in the rehab and you're sitting next to an elderly woman that's had a very sedentary life, she's not about to get up and start putting any pressure on that knee. So
right.
I was used a little bit as a shill in the rehab, and they put me next to someone and said, well, he can get up, why can't you get up? So, it worked out so well that in 6 months I was playing golf again.
Oh, that's wonderful. And then Dr. Mark did your hip.
He did my hip, and I thanked him right after the operation for going to medical school. And then I thanked him for paying attention while I was... That was super. That was a great job. It's a lot easier than the knees, though.
Oh, yeah. The hip is much easier in terms of rehab, in terms of getting up and moving along. And obviously the trigger finger was just a little something.
Yeah.
But you're looking great. I'm glad to see you. We share interesting things besides orthopedic surgery and different forms of cooking, which is great. Well, Stephen, thank you very much for coming in again.
and I'm happy to see you anytime, and I'm glad you had a great result. Keep playing golf. Anything I can do, I'm around for another year and a half.
Oh, good. That's good because I respect your competence, your personality, and I've had such good results with you and Dr. Bork. So he'll be around longer after you're gone, I suppose.
Yes, he
In
will.
case something else happens, I don't know.
That's wonderful.
But it's been
Stephen.
great, Roy. Thanks very much.
Thank you very much.
Good.